So I did a presentation at one of the plenary sessions, the stroke and migraine session, on our study using different AI tools to study the risk of stroke and cardiovascular outcomes in patients with migraine. And then the reason that we wanted to do this study is, as a practicing headache and stroke specialist, I really think of these questions very frequently. Like, we see patients with migraine very frequently in the clinic, like every day in the clinic. But some of these patients end up in the hospital with a stroke or debilitating cardiovascular disease. And many of these patients are young without vascular risk factors. So how do we identify these patients early to avoid developing this adverse vascular outcomes? And that is mainly the motivation of this study. So in this study, we did integrate several AI tools, like an AI ECG-based study, as one of the main tools. In addition, we also integrated other things like echocardiography, heart ultrasound results, and also detailed headache characteristic to see whether these factors individually and put together can help us identify patients with migraine that are at risk for vascular outcomes. We found that we investigated AI ECG, and that is a very cool tool that exists at Mayo Clinic. For every ECG done at Mayo Clinic, we can see the results of different AI algorithms. So for example, we have one AI algorithms that can tell the probability that someone may have undiagnosed paroxysmal atrial fibrillation. We also have another algorithm that shows the ECG estimated age, and that we use those two algorithms, mainly the one calculating the probability of atrial fibrillation and the AI ECG estimated age, and using that to calculate what we call delta age, which is the ECG estimated age, AI estimated age minus the actual age as delta age. And that is because that has been shown to be a marker of endothelial dysfunction. So we use those two AI ECG algorithms to predict cardiovascular outcome. In our cohort that included almost 30,000 patients with migraine, we found that higher number of AI ECG atrial fibrillation prediction model output, results from that particular AI ECG algorithm, and also larger delta age are predictive of adverse cardiovascular outcomes in patients with migraine. So that shows that AI ECG can be a very quick tool, because it's a 12-lead ECG that can be done quickly in the clinic, could help to stratify patients into a high and low risk group. So I think that is one very important results and important clinical implementation, because in the future we can incorporate, in addition to what we are already doing in the standard of practice, talking about their vascular comorbidities, other health conditions, we can also incorporate tools like a 12-lead ECG as part of the evaluation to see whether these persons are at a higher risk of developing cardiovascular outcome or not. Separately, we also analyze echo features, and we did echo, meaning the heart ultrasound, and we identify several abnormalities, like abnormalities in the tricuspid valve, left and right ventricle, and regional wall motion abnormalities are predictive of adverse vascular outcomes. And similarly to migraine characteristic, that patient with more frequent migraine, more severe headache, that can predict cardiovascular outcomes. So I think these are all very important research findings from our study. And going forward, what we are working on is building a multimodality prediction model, putting all those results together. Hopefully, in the future, when patients come in to our headache clinic, then we can say, based on all these features, incorporating AI tools, these patients are at a higher risk of developing stroke and vascular outcomes, and that we need to more closely monitor their vascular risk and do prevention, early prevention, to reduce the risk of stroke and vascular outcome.